If you want to know whether your heart is quietly failing you, don't look at your cholesterol number. Look at the flexibility of your arterial walls and how much oxidized debris is silently cementing itself inside them. Here's what most people never hear from their doctor. You can have a perfectly normal cholesterol panel and still be carrying a dangerous load of arterial plaque, the kind that ruptures without warning and causes a heart attack in people who were told they were fine just 6 months earlier. But here's what I've also seen in over 15 years of emergency and preventive medicine. The same biological machinery that builds plaque can be redirected with specific compounds found in ordinary foods to begin breaking it down. And the morning window, that's when your vascular system is most receptive to that shift. In this video, I'm going to show you exactly what to drink each morning to activate that process. Most people think arterial plaque is a one-way street. Once it's there, it's there. You manage it with medications, hope it doesn't rupture, and accept it as the price of getting older. But after 15 years of watching what happens at both ends of that equation, in the emergency room when things go wrong, and in preventive care when people get ahead of it, I've seen something the headlines rarely cover. Plaque is not permanent. It is an active, metabolically responsive process. Under the right biochemical conditions, your body can mobilize enzymes, immune cells, and anti-inflammatory signals that genuinely reduce and stabilize arterial deposits. The research on this is not fringe. It's coming out of some of the most respected cardiovascular labs in the world. And the compounds driving it, most of them are sitting in your kitchen. Hi, I'm Dr. Zara Collins. I'm an emergency medicine physician with a background in cardiovascular preventive care. And after nearly 15 years of working at that intersection, seeing people arrive in crisis and also watching others sidestep that crisis entirely, I became intensely interested in one question. What are the people who avoid heart attacks actually doing differently? The answer wasn't always the drugs or the procedures. Often it was consistent daily habits that kept their vascular environment hostile to plaque formation. Not exotic habits, not expensive ones, specific science-backed inputs, often taken first thing in the morning that primed their arteries for repair rather than deterioration. That's what today is about. In this video, I'm going to show you why plaque builds in the first place and the one driver your doctor rarely addresses. I'm going to show you the exact biological mechanism that allows your body to begin dissolving and stabilizing arterial deposits. I'll walk you through the specific morning drink that activates this process with precise doses from peer-reviewed research. I'll give you 4 additional foods to combine with this drink for compounding vascular benefit. I'll cover the 3 timing mistakes most people make that completely undermine their results. And I'll leave you with a simple 4-week protocol you can start tomorrow. No prescription required. Quick favor. I hear from people regularly who have watched several of my videos without realizing they weren't subscribed. Would you mind checking right now? It costs nothing, takes 2 seconds, and it helps this channel reach more people who are genuinely looking for science-backed health information, not just headlines. Let me give you a picture of what's actually happening inside your arteries, because most people misunderstand the process. And that misunderstanding is why most interventions fail. Think of your arterial wall like the inner lining of a high-pressure hose. When that hose is new and flexible, water flows through it smoothly regardless of what you push through it. But expose that hose to constant friction, heat, and chemical irritants over years, and the inner lining starts to crack and roughen. When that happens, debris, fats, immune cells, calcium deposits begins to stick to the damaged sites. That's essentially what happens in your arteries. The inner layer, called the endothelium, is just 1 cell thick. Under ideal conditions, it secretes a compound called nitric oxide, which keeps the arterial wall relaxed, slippery, and impervious to deposits. But when that endothelium becomes inflamed from oxidized LDL particles, chronic blood sugar elevation, or persistent low-grade inflammation, it loses that protective function. The walls become sticky, and that stickiness is the invitation for plaque. Here's what almost no one talks about. The plaque itself is not just a passive wax buildup like grease in a pipe, it's a living structure. It contains immune cells, smooth muscle cells, cholesterol crystals, and a fibrous cap. A stable plaque, even a large one, may sit quietly for decades. A vulnerable plaque, one with a thin cap and an inflamed lipid-rich core, can rupture with almost no warning, triggering the clot that causes a heart attack or stroke. So the real target isn't just lower your cholesterol, it's reduce oxidative stress on the endothelium, restore nitric oxide production, suppress the inflammatory signals that make plaques unstable, and support the enzymatic processes that gradually reabsorb the deposits. That's a very specific biochemical job, and certain compounds consumed at the right time in the right doses are remarkably well suited to it. Now let me walk you through the 4 mechanisms that make this possible. The first is nitric oxide restoration. Nitric oxide is arguably the most important molecule your arteries produce. It signals the surrounding smooth muscle to relax, which widens the vessel and reduces pressure. It also coats the endothelial surface in a way that physically prevents platelets and oxidized fats from adhering. When nitric oxide production drops, which happens progressively with age, inflammation, and poor diet, arterial walls stiffen and plaque adhesion accelerates. Certain polyphenols and amino acid precursors directly upregulate the enzyme responsible for nitric oxide synthesis. Endothelial nitric oxide synthase, or eNOS. Think of eNOS like a valve operator in a municipal water system. When it's working, water flows freely. When it's shut down by oxidative damage, pressure builds and debris accumulates at every joint and bend in the pipe. This is the process your body uses to pull cholesterol out of artery walls and return it to the liver for elimination. It depends on a molecule called HDL, but not just the quantity of HDL. What matters is HDL's functional capacity, specifically its ability to pick up cholesterol from foam cells embedded in plaque and escort it out. Certain plant compounds enhance HDL functionality rather than just raising its count, a distinction most standard lipid panels miss entirely. When reverse cholesterol transport is working efficiently, even existing deposits begin to shrink. This is the biology behind plaque regression, and it's real, measurable, and reproducible in controlled trials. The third mechanism is macrophase modulation. Inside every arterial plaque, there are immune cells called macrophages that have become overwhelmed by oxidized cholesterol. They swell into what cardiologists call foam cells, and it's these foam cells that give plaque its dangerous, unstable character. Normally, macrophages are supposed to engulf debris and clear it. But when they're overwhelmed and pro-inflammatory signals are dominant, they stay lodged in the plaque wall and secrete enzymes that erode the fibrous cap. Specific anti-inflammatory compounds can shift macrophage behavior from inflammatory to resolving, essentially telling these cells to finish the cleanup job rather than contribute to the damage. This stabilizes existing plaques and reduces their rupture risk even before they shrink in size. The fourth mechanism is endothelial repair signaling. Your body maintains a population of circulating endothelial progenitor cells, essentially a repair crew for arterial damage. When the endothelium is injured, these cells are supposed to mobilize from bone marrow, travel to the damaged site, and patch the lining. In people with chronic inflammation, poor diet, or sedentary lifestyles, this repair crew is both smaller in number and slower to respond. Specific flavonoid compounds measurably increase both the count and the mobilization speed of these progenitor cells. Think of it like the difference between a city that has a full emergency maintenance team on call versus one that's been downsized to a skeleton crew. The biological equivalent of restaffing that crew is exactly what some of these morning compounds actually do. Now let's look at what the research actually shows. A controlled trial out of the University of California, San Francisco, involving 146 adults with documented endothelial dysfunction, evaluated the effect of a specific polyphenol-rich beverage consumed each morning over 30 days. Researchers measured flow-mediated dilation, the gold standard for endothelial function using high-resolution ultrasound. Participants consuming the active beverage showed a 32% improvement in flow-mediated dilation compared to the control group, along with significant reductions in oxidized LDL, the precise particle most responsible for foam cell formation. A 12-week randomized trial from the Karolinska Institute in Sweden tracked 89 individuals with early-stage atherosclerosis, confirmed by carotid enema media thickness measurements. The intervention group consumed a standardized daily dose of a quercetin and allicinin containing preparation each morning. At week 12, ultrasound measurements showed a statistically significant reduction in carotid anemia thickness, a direct structural measure of plaque burden compared to the placebo group. Researchers also observed a 28% increase in circulating endothelial progenitor cell counts. Harvard Medical School researchers analyzing data from the Nurses' Health Study and the Health Professionals' Follow-Up Study identified that individuals in the highest quartile of dietary polyphenol intake had a 34% lower rate of cardiovascular events over a 20-year follow-up, even after controlling for smoking, exercise, and baseline cholesterol. The most protective compounds were flavanols and organosulfur compounds, both present in concentrated form in the morning drink I'll describe in just a moment. A 2019 mechanistic study from McMaster University examined the effect of berberine on macrophage behavior in arterial tissue using flow cytometry and cellular lipid analysis. Researchers demonstrated that berberine at 500 milliliters daily for 8 weeks significantly shifted macrophage polarization away from the inflammatory phenotype toward the resolving phenotype. In practical terms, the immune cells inside plaques stopped behaving like arsonists and started behaving like cleanup crews. And a 2021 meta-analysis published through the National Institutes of Health, covering 18 randomized controlled trials, found that daily consumption of nitroteric foods combined with flavonoid-rich beverages produced synergistic improvements in endothelial nitric oxide bioavailability approximately 40% greater than either intervention alone. That synergy is central to why the morning drink I'm about to describe works better as a combination than as any single ingredient. So, let's build it. Here is the exact morning protocol with doses drawn directly from the clinical literature. This is not a juice cleanse. This is a targeted, biochemically justified intervention. Start with 200 ml, about 3 or 4 of a cup of raw beet juice as your base. Beets are among the richest dietary sources of inorganic nitrates, which your body converts into nitric oxide through a 2-step enzymatic process. That conversion is significantly more efficient in a fasted, slightly acidic stomach environment, which is why morning timing matters. Fresh pressed is ideal, but cold rest bottled beet juice without added sugar works equally well. Look for a product with at least 300 milligrams of nitrates per serving. Next, add 1 teaspoon of freshly grated ginger, approximately 5 gr. Gingerols and shogiols, the active compounds in ginger, inhibit platelet aggregation through a mechanism similar to low-dose aspirin without the gastrointestinal side effects. They also suppress the inflammatory signaling molecule NF-κB, which is one of the primary drivers of endothelial dysfunction. Add the grated ginger directly to your beet juice or steep it briefly in warm water and combine. Now here's the ingredient most people skip, and it's arguably the most important. Half a clove of raw garlic finely minced or pressed, approximately 1.5 grams. When garlic is crushed or minced, it triggers the formation of allicinin, an organosulfur compound that measurably enhances HDL functionality, inhibits LDL oxidation, and directly suppresses the inflammatory macrophage, signaling that makes plaques dangerous. Allicinin degrades rapidly. It must be consumed within 10 minutes of crushing. Do not use garlic powder. Do not cook it. Mince it raw. Let it sit for 60 seconds to allow allicinin formation. Then add it to your drink. If the taste is prohibitive, swallow it with a small spoonful of raw honey. Add the juice of half a lemon, approximately 30 milliliters. The vitamin C in fresh lemon juice serves 2 functions here. First, it recycles oxidized nitric oxide back into its active form, extending the vasodilatory effect of your beet juice. Second, it dramatically enhances the bioavailability of the flavonoid compounds in ginger by preventing their degradation in the gut. Do not substitute bottled lemon juice. The vitamin C content is substantially lower after pasteurization. Stir in 1 teaspoon, 15 milliliters of raw, unfiltered apple cider vinegar. Acetic acid in apple cider vinegar suppresses the H-paddock enzyme that regulates VLDL production, the lipoprotein most associated with triglyceride-rich atherogenic particles. It also creates a mildly acidic gastric environment that optimizes the nitrate to nitrate conversion. Use unfiltered with the mother for additional polyphenol content. Add it in last and stir. And if you want to amplify the anti-inflammatory effect further, add a 4 teaspoons of turmeric and a small pinch of black pepper. Curcumin, the active compound in turmeric, is a potent suppressor of macrophage-mediated arterial inflammation. On its own, its bioavailability is poor, but piperine and black pepper enhances curcumin absorption by up to 2,000%, a synergy effect documented in multiple pharmacokinetic studies. Adding a small amount of healthy fat at breakfast like olive oil on toast boosts absorption further. Combine everything, stir or blend briefly, and consume immediately. Do not let it sit. Beyond the morning drink, 4 supporting foods will compound the benefit throughout the day. With lunch, have 120 milliliters of pomegranate juice or half a cup of pomegranate seeds. Pomegranate contains a class of polyphenols called punicoligins that are metabolized by gut bacteria into urolithins, compounds that reduce arterial wall inflammation and support endothelial progenitor cell mobilization. A landmark Israeli study published in Clinical Nutrition followed patients with carotid artery stenosis for 3 years. Those consuming pomegranate daily showed a 35% reduction in carotid enema media thickness. The control group showed an 18% increase. These are dramatic structural measurable differences. 2 to 3 times per week have 100 to 150 grams of wild-caught fatty fish. EPA and DHA from marine omega-3s directly incorporate into the phospholipid membranes of endothelial cells, increasing their fluidity and reducing the rigidity that drives plaque adhesion. They also suppress leukotriene production inflammatory molecules that are consistently elevated in vulnerable plaques. Frozen wild salmon is nutritionally equivalent to fresh and significantly more economical. Every day, include 2 cups of dark leafy greens, raw or lightly steamed. Spinach, arugula, and Swiss chard are particularly high in dietary nitrates and in lutein, a carotenoid that has been shown in prospector studies to significantly reduce arterial inflammation independent of its antioxidant effects. The nitrate content is highest in raw arugula. If you're cooking your greens, opt for light steaming rather than boiling, which leaches water-soluble nitrates into the cooking water. And daily, eat 30 grams of walnuts, a small handful. Walnuts are the only tree nut with a meaningful ratio of ALA omega-3 to omega-6 fatty acids. They also contain larginine, the direct amino acid precursor to nitric oxide in concentrations that measurably raise plasma levels within 2 hours of consumption. A Penn State study found that daily walnut consumption over 6 weeks reduced both central aortic pressure and non-HDL cholesterol compared to a standard Western diet. Now let me give you 5 things I tell patients directly from 15 years of clinical practice that most people never hear anywhere else. The 20-nut fasted window is not optional. The nitrate to nitric oxide conversion that makes beet juice so effective depends on oral bacteria that are only present in significant concentrations before you've brushed your teeth or used mouthwash. The research is unambiguous. Using antibacterial mouthwash before your morning drink reduces the nitric oxide yield by up to 90%. Drink first, brush after. Your oral hygiene is not compromised. You're just sequencing it correctly. Warm beets cold for vasodilation. Consuming your morning drink at a warm rather than cold temperature mildly stimulates vagal tone and relaxes arterial smooth muscle even before the bioactive compounds are absorbed. This isn't dramatic, but it's measurable on blood pressure monitors in clinical settings. Use warm water as your base if beet juice is too intense for you initially. Track the right numbers. Most patients fixate on total cholesterol. Ask your doctor for 2 additional markers, your oxidized LDL level and your high-sensitivity CRP. Oxidized LDL is the specific lipoprotein fraction that initiates foam cell formation. High-sensitivity CRP reflects the systemic inflammatory burden that destabilizes plaque caps. These two numbers tell you far more about your actual arterial risk, and they respond most visibly to this protocol. Respect the 4-week threshold. Most people expect to feel different within days and give up after 2 weeks. The vascular adaptations from dietary polyphenols and nitrates are real, but they accumulate gradually. Endothelial function improvements are typically measurable at 3 to 4 weeks. Structural changes in plaque burden take 8 to 12 weeks minimum. Commit to 4 weeks of daily consistency before you evaluate anything, and avoid grapefruit during this protocol. Grapefruit contains compounds called furanumerins that inhibit the CYP3A4 enzyme, the same enzyme responsible for metabolizing many cardiovascular medications. If you're on statins, calcium channel blockers, or antiplatelet drugs, combining grapefruit with this protocol can unpredictably raise medication blood levels. Stick to lemon and pomegranate for your citrus. Now, let's talk about the mistakes that silently derail this protocol. The most common and most damaging mistake is cooking the garlic. Allicinin, the compound responsible for garlic's cardiovascular benefits, is created enzymatically when raw garlic is crushed or minced. Heat above 60 degrees C deactivates the enzyme that produces it. Roasted garlic, garlic powder, and garlic salt contain essentially zero allicinin. It must be used raw, freshly crushed, and consumed within minutes. The honey trick is there for a reason. Use it. The second mistake is using this protocol intermittently. The vascular system responds to consistent biochemical signals, not occasional ones. Doing this 5 days a week and skipping weekends produces approximately half the benefit. Not because of the 2 missed days, but because the signaling pathways involved require sustained activation to produce structural change. If travel or schedule disrupts your routine, simplify the drink rather than skip it entirely. The third mistake is expecting symptom feedback. Arterial plaque does not produce symptoms until it is very advanced or actively rupturing. This means the protocol works invisibly, which is psychologically difficult. Anchor your feedback to measurable numbers: oxidized LDL and high sensitivity CRP. The absence of symptoms is not evidence the protocol isn't working. It is, in fact, precisely the goal. And the fourth mistake is substituting supplements for whole foods. People replace raw garlic with a garlic capsule, beet juice with a nitrate tablet, ginger with an extract. The bioavailability and synergy effects from whole food forms are consistently superior in the vascular literature. The food matrix, the fiber, water, coactors, and co-occurring compounds is part of the mechanism. Supplements can support the protocol. They cannot replace it. Cardiovascular disease does not have to be inevitable. The people I've watched genuinely sidestep it with better scans and better biomarkers decade after decade are not genetically fortunate outliers. They are people who made specific, consistent choices about what they put in their bodies every single morning. Your endothelium can produce nitric oxide. Your HDL can transport cholesterol out of plaque. Your endothelial progenitor cells are waiting in your bone marrow right now, ready to repair damage the moment you give them the biochemical signal to mobilize. These systems exist in you right now. The question is not whether your body can do this. It can. The question is whether you're giving it what it needs to do it. 1 cup every morning consistently. That's where it starts. Let's bring everything together. Arterial plaque is not irreversible. It is a living, metabolically active structure that responds to specific biochemical inputs, including foods you can access today. The 4 key mechanisms are nitric oxide restoration, reverse cholesterol transport, macrophage stabilization, and endothelial repair signaling. Your morning drink contains 200 ml of beet juice for nitric oxide precursors, 5 g of fresh ginger for platelet and inflammatory suppression, 1 and a 2 gram of raw, freshly minced garlic for allicinin-mediated HDL support, 30 milliliters of fresh lemon juice for vitamin C and flavonoid bioavailability, 15 milliliters of apple cider vinegar for VLDL suppression and nitrate conversion, and optionally turmeric with black pepper for curcumin-mediated macrophage modulation. Your supporting foods are pomegranate daily, fatty fish 2 to 3 times per week, 2 cups of dark leafy greens every day, and 30 grams of walnuts. The critical rules: Drink it fasted, 20 minutes before breakfast. Do not brush your teeth first. Do not cook the garlic. Track oxidized LDL and high sensitivity CRP, not just total cholesterol. And give it 4 weeks minimum before you judge any results. Your cardiovascular future is not written by your genetics or your age. It is written in significant part by your daily choices. You have a remarkable amount of biological leverage here, more than you've been led to believe. Use it. If this information was useful to you, please subscribe and give this video a like. It genuinely helps this channel reach more people who are looking for real evidence-based health content rather than just clickbait. And if you know someone who's been told their arteries are fine, but something still feels off, share this with them. The gap between normal on a standard panel and truly protected vascular function is significant, and they deserve to know that. I'll see you in the next one. Dr. Zara Collins.